Welcome to Graceful Aging. I'm your host, Gregory Bader. Today we're going to talk about not a difficult topic, but something that we all experience at some point in life, probably more than once, and it's grief. Good grief, you might say. Bad grief, you might say. Whether it's good or bad, grief exists. It comes up on us at different times through the loss of a partner, through the loss of a physical ability, through the loss of a privilege. And it has different feelings for everyone. We're going to learn about those different feelings and what you can do about rebuilding your life and finding that meaning in your life that may have been lost with another person or activity that is now past. We're also going to talk about what you in your 30s and your 40s and 50s can do with someone that you know who's experienced grief. What do you say at those times? What do you not say? And what do you do? Those are all things that mistakes are made, but more importantly, good characteristics, good actions can be taken that really make an impact on someone's life. So that's what we're all about today on Graceful Aging. We're talking about grief with a special guest, Connie Doyle, a bereavement coordinator from the Visiting Nurse Association. Connie has got great insight that we want to share with you today on Graceful Aging. It's right around the corner. Stay with us. Welcome to Graceful Aging. I'm your host, Gregory Bader. We have Connie Doyle, a bereavement coordinator, with us today. Connie, thank you so much for being with Graceful Aging.
Thank you for having me.
Now, there's an expression that your dad probably has used or somebody in your life has used. I use it occasionally, good grief. And we're astonished when we use that phrase. And isn't death and loss part of astonishment as well?
It is, and death and loss is really a huge transition period in people's lives, and it doesn't always have to be a devastating time period for them.
Is there such a thing as good grief?
There can be, because as a bereavement coordinator, I can even help families ahead of time start preparing for a death in their family and do some anticipatory grief work. So there can be good grief, and there can be good times and good memories after somebody who you love dies.
You know, anticipatory grief is a pretty big phrase. Mm-hmm. So how much in advance do you work with families? You know, if I have a terminal illness with a mm-hmm. spouse, is there a recommended period of time in advance to begin that process?
Well, as a hospice bereavement coordinator, I can be called in 6 months before someone dies or several days before someone dies if a family is identified as having some issues or conflicts that they may need some help working through. So I have the privilege of going into a patient's home or whatever facility they may be at, and helping the family with closure, helping them solve some conflicts, maybe forgiving one another, helping them say goodbye before the death actually occurs.
Mm-hmm. All pretty, sounds like valuable things mm-hmm. to do, aren't mm-hmm. they?
It's an amazing experience sometimes.
Now, is there a point where grief is bad, that there's bad grief?
There can be bad grief. I think sometimes when people don't have that time to have the anticipatory grief, people can feel maybe guilty about things that they didn't get to say, things that they didn't get to communicate with the person. They may have wishes that they wish that they would have been able to take care of with that person.
You know, we're going to talk in the second half of the show about what individuals can do to help people in a grieving process, mm-hmm. but just those things that you mentioned probably would be pretty hard in many cases for a spouse or an adult child to get out of mm-hmm. You know, their parent or aunt or uncle, wouldn't it?
Mm-hmm. Yeah, but you know, we really help facilitate the communication between the family, and we see many positive benefits of that, helping people to grieve even before the death occurs.
Now,
Is there an appropriate length for a grieving process? I think, growing up, people have said, well, maybe a year's time and
Right.
or a couple of months and you'll get
Right.
over it. Is there anything that you can share with people
Yeah.
of how long they could expect grief to last?
You'll hear a lot of different guidelines from people, and one thing I like to tell people is there is no one-size-fits-all grief experience. And grief does not take just 6 months or a year. Everyone has their own timeline for grief, and grief can go on for many years. The pain does get less raw, and people develop hope, and they find hope in their future again. So no, there is not a timeline for grief.
Is there a suggested? I'm going to push you. If it lasts, like intense grieving, where I can't get over
Right.
talking about the person. Everything I do or breathe seems to be relating to them, and that goes on for.
Sure, you can be talking about complicated grief, and I do see this, and sometimes people have bouts of depression. I always recommend that if people are experiencing more complicated grief, that they see their primary physician and talk about their grief. The grief can take a toll on us physically and mentally. So people do need help along the way and support sometimes.
Now, for family members, if they were witnessing someone still grieving, are there any warning signs that they could look for that
Sure.
might be that complicated grief that
Sure.
you talked about?
People who have complicated grief sometimes can't stop crying. They may not be taking care of themselves well. They may not be resting, sleeping well. They may not be eating well. Some people tell me they can't get out of bed in the morning. They feel like they have no reason to go on. Isolating yourself in the home, not answering the phone, not going out and doing social activities that you were once engaged in are all warning signs, I think.
Well, we're going to save again for the second half how to confront those. But are there 3 of those things that have to occur, or just one of them? And what length of time should I be seeing those things over?
I think if you're really witnessing a loved one or an acquaintance who is isolating themselves, who is not taking care of their nutrition, and just not able to get out of bed, shower, take care of themselves on a daily basis, that those are huge warning signs that they may need some extra support and help.
Now, as we age, does grief change? Does it get easier? Is it harder? Is it different? What?
I think for the older population, it can get a little different because they may be experiencing multiple losses in a short period of time. They may have had a spouse die, yet 6 months down the road a sibling dies, and then maybe a neighbor or a friend dies. So their grief becomes maybe a little more intense and might be stretched out over a longer period of time because of the multiple losses.
And I would imagine that there's grieving as well, maybe with the loss of their functioning or
Absolutely.
or activities or driving, and can that provoke the same type of grief?
Sometimes people don't realize that they're already grieving. You're faced with your own mortality every day, and as we age, sometimes we don't have as much strength and stamina, and people are feeling a loss of beauty, and they're experiencing problems maybe completing some roles that they used to carry out in their family.
Now, are there stages of grief? I remember in college, and I think it's still a good book on death and dying by Elizabeth Kubler-Ross. And as I recall, if I got my lesson plans accurate, there's 7 stages. But are there stages to the grieving process that you can
There
expect?
are different stages of grief, and most of the stages that you really hear about are people being able to accept the death, being able to express their feelings and thoughts about it, being able to find activities and things that they enjoy again. So there are different stages that people move through in grief, but people don't follow those stages in an exact pattern. Everybody grieves differently. And it takes people a different amount of time to go through the stages.
Can there be relapses of grief? In other words, can you go through it and you think you've got a handle on it and then suddenly you crash?
Simple things like anniversaries, holidays, birthdays of the deceased, all of these things can send people spiraling backwards in their grief, sometimes for moments, days, weeks. So, you do go back and revisit some of these stages.
Yeah, it's a good point. And as far as the big holiday events like you just described, what do you tell people, knowing that they may have one of those more difficult periods? What type of counsel do you provide or advice do you provide to people?
I always try to help people plan something for that particular date. Getting together with friends and family, somehow memorializing the person who has died, whether it be lighting a candle and having that be part of your centerpiece, whether it's everyone taking a trip out to the cemetery that day, sitting around and telling stories about that person, sharing things with the younger generation that might be there, stories that maybe they're not familiar with about the person who died. And often I tell people that the anticipation
Tough word.
of these dates is more difficult than the actual date itself.
I would imagine if someone had a favorite activity, whether it's golf or going to a baseball game, that might be a nice way to celebrate their life as well.
Absolutely.
In those days.
Yes, to pick maybe something special that person loved and celebrate them in that way.
As we age, we also, unfortunately, can experience some complications or illnesses. And does illness and those types of health complications, does that compromise or make grief more difficult for people?
If you're experiencing your own physical health problems, it can definitely complicate your grief. And a lot of people become more isolated as they're having these health problems, and maybe they're not able to get out of the house or have social contacts, and they just don't feel good, and they're just not able to grieve appropriately.
Now, we think as we age, and we get so much more experience in life, and those, the generation in their 30s and 40s who are dealing with older parents or grandparents, probably a lot of times think, oh, well, they know how to handle it. They've been there before, and so they ignore whatever grieving there is. Is that a right thing for younger generations to do?
I think sometimes the younger generation needs to step in and sit with the person, to be with them, to be for them, to ask them to tell their story, because sometimes the older generation has been taught to kind of keep their feelings inside, to go on, and that they're going to be okay, and it's a sign of weakness sometimes, especially for men, to share their feelings. So I think we as a younger generation can help them, encourage them to open up and share.
Well, you hit probably the nail on the head for most of the 70 and 80 and 90-year-old generation, that sign of weakness. I'm not gonna cry. I'm not gonna show my grief. When you deal with someone who's 70, 80, who's lost a spouse or lost someone close to them, what advice do you give them about trying to bring those feelings out?
I really try to help them normalize their feelings and let them know that no matter what they're feeling, it's okay, and that you need to find time to grieve, whether it's openly or quietly by yourself in private, and that crying and expressing these emotions can be very healthy.
Well, let's come back with some other healthy suggestions. We'll be right back with a lot more useful tips for you in a grieving process. Stay with us. We're back on the grieving process with Connie Doyle, a bereavement coordinator with great experience. And do you enjoy your job as a bereavement coordinator?
I do. I had a death experience as a child, and I I know that this is why I do what I do. I find it very meaningful and almost a privilege to work with the families that I do.
You know, with an aging population and with death rates as they are, we all pass at some point. Is this a growing field? Is it a good career for people to consider?
Oh, I think absolutely. And, you know, I think people are sometimes a little more willing now to reach out and ask for help than they have been in the past.
And do you see the need for bereavement counseling and grief counseling increasing?
Yes, yes. Especially in the populations where we're seeing more sudden deaths and suicides and traumatic deaths.
You know, it was a little bit alarming as far as doing the research for the show on grief that actually, and it's a show unto itself, but suicide amongst older adults is at a pretty alarming rate, isn't it? And you know, are there some warning signs for folks out there who are dealing with grieving older adults that they should be especially watchful for, you know, in the event it gets very serious like that?
Right. I think older adults who are physically ill and have had a spouse die and who are very isolated and alone are this population of people that you're talking about, or who are more likely to commit suicide. So those are the people that I think we really need to watch as counselors and bereavement coordinators.
And how does a family or a neighbor watch for that, and what would they do?
Well, you're going to want to watch for things such as the person really isolating themselves, not taking care of themselves.
Some of those same things you talked about in the first half then.
Sure.
Okay, so I see those things, and what do I do then? Do I talk with them? Do I call the police?
You
what
would
do I
want to
do?
talk with them and try to get in contact with family members if they do exist. Sometimes these people start talking about not wanting to go on, not wanting to live without their spouse. So there are, you know, warning signals that you need to pay attention to. But in an emergency situation, yes, you would call 911.
Okay, well we're going to have you come back, I think, on a special show on that. Let's talk, I'll just say the normal grieving process now. You know, I just had a dear cousin who lost his wife after 36 years of marriage. She was 65 and she was gone in the matter of months. And I said to him, not knowing what to say, oh, just hang in there. And then as I'm reading for this show, a couple of people said, well, that's one of the worst things that you can say. Are there other bad things that you can say?
I think saying to someone, well, you know, it's been 3 months or 6 months. I don't understand why you're still crying. I don't understand why you don't feel like coming to my house for dinner. Those are the types of things that maybe you don't want to say to somebody. And it's awkward. It's awkward to find the right thing to say. I think listening is most important.
What if I've been through the experience myself and my grandmother died and I saw how everybody operated, so can I give you advice now and tell you this is what I think you should do? Is that a good approach?
And rather than giving advice, I would want you to share your story with me. It's very important if you've had a grief experience of your own to be able to share your story with people. Your grieving experience is going to be different from theirs, but there's going to be similarities. And people can draw from that and say, wow, he had a really hard time, but he made it through. And maybe I can find some hope in the future too.
So personalize my story, but stay short of being Ann Landers to him, it sounds like.
Exactly.
Well, are there more appropriate things to say to someone who's just experienced a loss? What are some things that people can say that will have an impact for others?
I think, you know, again, you want to encourage people to tell their story. Ask them to share special memories about the person who died. Ask them how they're feeling. Try to normalize their feelings for them and say, you know, boy, I remember feeling that way when my wife died or my cousin died. letting them know that they're loved and that you're there for them, and follow through with it.
Now, probably there's some stand-pat phrases that people use. Oh, call me if you need anything. Is that useful?
If the person is open to calling you if they need anything, but I like to tell people, go over with a dish of food. Go over and not only take that dish of food, but sit down and have dinner with that person. Give them, the time and the opportunity to talk and share with you.
Well, if you need anything, just call me, though. Just call me. I'm here for you.
So you should be calling and checking on that person several times a week, or showing up at their door instead of waiting for them to come to you, because it's difficult, especially for the older population that we're talking about, to sometimes reach out for help.
As we were talking about before the break, it's a very resilient group of people. I mean, as we get older, we get more resilient, and we've done it up to this point, and we don't want anybody's
And
help.
I can take care of myself.
Right. How do you break through? Are there other ways to break through and provide help for people?
I also like to tell people that it's okay for them to ask for help and to let their family members or friends know that they're having a difficult time. That it's okay to say, I may need you, or I'd like you to come over, or can you come stay the holiday with me, or spend a night after my husband has died.
And do you find, as far as in a grieving process, what are the things that people do need besides words? What are useful things that can kind of cut into that grief that people can do?
Helping prepare meals, keeping them company, offering to take them and do many of the legal tasks that have to be done that can be quite confusing after somebody dies.
You know, with all the mistakes that we make in life with what we say, if I've made a mistake at a funeral home or over the phone, I've just been awkward in my speech, how do I correct that? What do I say, and when do I say it, or do I ignore it?
I don't think you necessarily ignore it. I would just maybe try to explain yourself better and just let people know that you care.
You know, I think it's interesting what you talked about before, that the grieving process can last a long time. So, you know, most of us are accustomed to just those first few days or hours after the funeral process, but I guess we could express sympathy months later as well, couldn't we?
Sure, because after the funeral's over and the wake's over and everyone goes home, that person is left alone. So it's really important to drop in, do some household tasks for them, get them back out into the community, ask them to go to dinner with you, encourage them to do things as those weeks and months go on.
But then if somebody doesn't want to do that, you know, you invite them out for dinner and they don't want to, it's pretty tough to, how far do I go with, oh, come on, it'll be good for you?
Right, and you can't push somebody, and some people do, prefer to grieve alone. But calling, letting them know that you're there, offering to spend time with them in their house, those are things that you could do possibly instead.
So let's say I'm 40 years old, I'm 30 years old, and my grandmother just lost her husband, my grandfather. How does someone 30 or 40 impact their grandmother's life usefully after a loss like that? What would be some...
I would want to spend time with my grandmother. I would encourage her to talk about her life with my grandfather, to share things with me, share memories and share stories. I would encourage her to go through his belongings with me. All of these things are time well spent together, but you're also doing grief work together.
And what do I expect? Is there a length of time that I should have any one of these experiences? Is it an hour or a half hour or a whole day?
You know, sometimes people are tired when they're grieving, so you don't want to wear them out either. So I think maybe short periods of time over, you know, and if you can be there several times a week, that would be good, or just touching base with them on the phone several times a week.
Now, what resources, you know, we've got churches and we've got funeral homes, a variety of places that deal with grief and grieving. How do I get involved with one of those if I think I may need that?
Calling your local hospitals, churches, funeral homes, a local hospice, and talking to the bereavement coordinator. All of these suggestions, they would have community resources for people to attend support groups or seek out individual counseling.
So give me the pitch for a support group. I've never been a support group person, and so I just suffered a loss. What's a support group going to do for me? I have to talk to all these strangers?
A support group is a safe environment for you to go and to be with other people who have had a similar experience. You're not pressured to talk there. You can sit and absorb and listen, and if you feel like sharing, you can, but you're very welcomed at a support group.
Is silence the best remedy of it? Should I just keep it all inside and, you know, and I'll deal with it myself and it'll suddenly go away and I'll be able to live my life? Does it just happen miraculously like that?
Some people do handle grief that way. I think to keep it all inside and not let it out, you may see the wear and tear on your body physically and mentally. Grief, if it doesn't come out in our thoughts and feelings, it sneaks out somewhere else.
So close it out. Can grief actually turn positive, and do people survive the grieving period?
People have been surviving the grieving period for years, and grief can be positive. It's time that maybe you can reinvent yourself again and find hope and find meaning in your life, and always hold that loved one close in your heart.
Well, thank you so much, Connie Doyle. Those are great words for people, and thanks for being with Graceful Aging. Thank you for joining us today. If you're experiencing grief or know someone who is, take Connie's words to heart. Help them out. Broaden your reach into their lives. It'll be most useful. That's it today for Graceful Aging. We'll see you next time.